Good afternoon, welcome back. I'm Marcus Peter. As is the case every week, my friend Dr. Gregory Popcak generously joins us with his time and his talents. Greg is no stranger to this program. He and his bride co-host More to Life on EWTN Global Catholic Radio Network and Ave Maria Radio. They also are the creators of the Catholic Households on Mission, HOM app and network. And we talk about questions pertaining to mental health in the Catholic Church. A new CatholicTV survey suggests widespread emotional distress amongst U.S. Catholics. And that raises questions about how Christians tackle the question of mental health as Christians, but also as an institutional church. Greg, thank you for joining us. How are you?
I'm well, thank you. It's a pleasure to be here.
It's always a joy to connect with you. And you and I have talked about this before. There's a tendency amongst very faithful Christians to sidestep questions pertaining to legitimate mental health needs and concerns. Would you please share with us why this tendency amongst faithful Christians?
Sure, and I think this is a common problem that we run into both on the show More to Life and through our pastoral counseling practice at CatholicCounselors.com. But the technical term for what you're describing is spiritual bypassing. And it's the idea that I should be able to pray this problem away, or if I was just a faithful enough Christian, I wouldn't have this problem in the first place. We believe that somehow grace is meant to just make these things magically disappear. The metaphor I like to use with our clients through CatholicCounselors.com or through the radio program, though, is that if we imagine that we were a car, grace would be the fuel that we put in the tank. So the sacraments, the prayers that we say, the spiritual practices that we engage in fill our tank with really good fuel, high octane, if you will. But if we have a full tank of great gas, but 4 flat tires, we're still not going anywhere. You know, if we have a full tank of gas and a cracked engine block, we're still not going anywhere. As St. Thomas Aquinas put it, grace builds on nature, right? It doesn't supplant it. And so because of that, we have to give God something good to work with. And of course, God is constantly calling us to healing and working in our lives to heal us, but he gives us earthly means through medical practice and psychological practice to make sure that we are a well-honed, well-tuned instrument to be used in God's hands to do his work. And so that means that even if I am the most faithful Catholic person, the most devout and sincere Catholic faithful individual, I'm still going to need to do work on my emotional health, my relational health, and my physical well-being too.
You bring up a crucial point about the fact that God doesn't destroy our nature. He wants to build it and perfect it. Grace builds upon that nature. To that end, I also want to invite you to speak to the fact that we've gotten really good, especially in science, about the physical type of medicine. But the avenue of mental health and, anywhere from proper research to strategies, there's still a tremendous amount of work that needs to be done and corrected too. People like you and your bride are helping bring that spiritual corrective to where the avenue has gone astray.
Yes, thank you for that. And I think that's a big focus of our work. How do we interpret the empirical insights from contemporary counseling psychology through the lens of faith so that people don't feel like they have to betray their faith and beliefs and values to become mentally healthy? Because you don't. In fact, there's a lot of overlap between what the psychological sciences say about what leads to a healthy functioning person and relationship and what the Catholic Church teaches about the same. And so a lot of our work is really guided by St. John Paul's theology of the body, which St. John Paul said was his attempt to promote a comprehensive view of the person. Like what does it mean to be a flourishing human person in healthy, holy relationships? And a lot of actually all of it, we've not run into a case where it's not, is supported directly by psychological science and research. And so it's our job as Catholic counselors and my team at CatholicCounselors.com to really interpret that information through that lens of faith so that we can give people the best of both worlds. Going back to this study for a second, the study that you mentioned found that in a representative sample of almost 1,600 Catholics, 69% report chronic fatigue, 66% struggle with sleep, 55% have recently felt hopeless about something, 86% say that faith is central to their lives, but up to a third of Catholics have even thought about self-harm in the last few months. So this is a significant challenge that we are facing. And unfortunately, a separate study by Pew Research found that over 70% of priests don't feel that they've got the adequate training to deal with even the most common problems that their parishioners bring to them, because their preparation is mostly sacramental and liturgical, but it's not pastoral in the sense of kind of pastoral psychology. And so there's a lot of work that the church needs to do in this area. In fact, I don't want to go on too long here, but it dovetails well with my dissertation research that I did in 2005 that looked at nationally Catholic versus Protestant perceptions of the adequacy of local and church-based mental health services. And it found that although Catholics and Protestants, faithful Catholics and Protestants, both value faith-based options over secular options, Catholics are much less satisfied with the options that are available to them than their Protestant counterparts are. And also Catholics, in our study, said that they wanted 17 different competencies in their counselors than Protestant counselors have. So where Protestants tend to view or want counselors who were educated in biblical approaches to some problems, Catholics wanted counselors who were up to date with the most recent psychological secular approaches to treatment, but could also integrate their Catholic faith into that. And so we want a much more holistic approach to counseling than many evangelical Christians especially.
In other words, the expectation, especially amongst Catholics, for mental health needs is a lot higher, which that can correspond to a lot of reasons that you've shared about in the past, but also just shared. This also seems to tie in with a lot of the CDC studies that you and I have spoken about in the past, which is, rising depression and anxiety rates that we're seeing, even amongst people who don't have a religious outlook of life. So we're seeing a similar pattern happen within the church. Can you please comment on how, therefore, the Catholic institutional church needs to have a better response to this?
Yeah, I mean, I think we need to recognize that this, that emotional problems, relationship problems, mental health problems are not something that only a small percentage of people experience. Upwards of 30% of adults will experience some form of depression, anxiety, mental health problems, relationship problems in any given year. And that's a huge number, especially when you talk about the number of Catholics. And we are not really responding adequately to that. That's really the mission of CatholicCounselors.com, our ministry. But it's a challenge because, as I was just sharing, Catholics really want a professional who is capable of interpreting the most recent empirical insights from counseling psychology through that lens of Catholic spirituality and theology. And there really aren't any organizations training people how to do that. So we work very hard to make sure that any counselor I hire goes through a period of formation before they would see their first client that could last 6 months or more, where we're doing reading, weekly discussion, case conversations. And I want to make sure that all of our people are really grounded both in the psychological research and the Catholic theology so that we can really provide that to folks. But I'm not aware of any other programs, academic or otherwise, that do that. Now, there's an organization, the Association for Clinical Pastoral Education, which is responsible for certifying hospital chaplains. And more recently, they've taken over the training of pastoral counselors in general. Mm-hmm. But I think there are maybe 6 Catholic, maybe a dozen Catholic members, and my team are all of them, essentially. So, which is not to say that other people aren't doing good work. I don't mean to imply that. Yeah. But I'm saying that for the most part, it's self-styled, right? It's I'm a faithful Catholic counselor who wants to do counseling, so I'm going to kind of put it together in my own way, which is fine as far as it goes. But we want to make sure that we're really using as research-based approaches to integrating faith and counseling as possible. And there is actually a lot of good research that talks about how to do it well. But I'm not convinced that there are a lot of Catholic professionals who are trained in that.
We're down to under a minute left in this segment, Greg. So for parents listening, but also just generally anyone listening, everyone's aware of the mental health crises of the modern man, let alone the modern churchgoer. Can you please say a few words of exhortation, but also to plug some of the great work you're doing?
Well, thank you. That's very kind. And I have to say, look, if you're suffering, one thing that we know as Catholics is that suffering is part of life, right? And it's an inescapable part of life. And that, in fact, we are privileged as Catholic Christians to cooperate with God to bring healing to suffering, to bring peace out of chaos, to bring order out of misery and suffering. And so getting the best tools available to us is really critical to our spiritual journey as well. So if you are suffering in your relationships, in your emotional life, in your mental health, that's nothing to be ashamed of. That's to embrace that, to recognize it, and to open yourself up to the healing that God wants to give you is exactly what he's calling all of his children to do, so that he can build on that nature and give you the healing to your body, mind, and spirit that we all long for.
My guest has been Dr. Gregory Popcak. He and his bride Lisa co-host More to Life on EWTN Radio. They also are the producers of Catholic HOM, Households on Mission. Find out more about CatholicCounselors.com and Catholic Households on Mission, and let's beat this mental health crisis with sound research and the faith. Stay tuned. I'm Marcus Peter.